Coming up today, she lived with seizures for years, only she didn't know they were seizures. The long journey to the right diagnosis and best treatment that finally has this young mom living seizure-free. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Epilepsy affects millions of people, but remains one of the most misdiagnosed neurological conditions. Seizures can take many different forms, not just the dramatic convulsions that we usually associate with epilepsy. Most seizures are so subtle or so hard to describe, they make diagnosis really a challenge. So today, we are meeting a young mom whose journey with epilepsy took nearly a decade to unfold, although for most of those years, she didn't even know it was epilepsy. But through the frustration, with resilience and an expert care team, she finally is living seizure-free. And we are so glad to be joined now by Alicia Shanost, who is going to be sharing her story with us today. It's a really great story. How are you today?
Thank you. I'm really well now.
Well, you're really well now. Well, we are so glad to have you with us today. We're so glad to be joined by Dr. Carol Ulloa, who is Alicia's epileptologist. Always great to have you. She's also the director of the Comprehensive Epilepsy Center here at the University of Kansas Health System. Also, Jennifer Chang, neurosurgeon here at the health system, who operated on Alicia. Dr. Chang, always great to have you with us.
Thank you.
Alicia, your surgery with Dr. Chang happened a couple years ago. But you needed to rewind. Let's rewind the surgery. This happened about 10 years ago. It was another surgery that you had.
Yes.
So let's talk about that. This all started with one of the most common surgeries. You had your tonsils taken out. So tell us what happened next.
So right after that, I had normal recovery symptoms, and then turns out it was actually much worse than we thought. I was pretty, I don't know. I had some underlying medical conditions that we didn't realize. I was on hormonal birth control, I had a blood clotting factor, and I got really dehydrated. Perfect storm caused me to have a clot in my venous sinus that caused a stroke.
So you had a stroke.
I had a stroke. It presented as a grand mal seizure, and I was treated at the local hospital in Pittsburgh. But luckily, Dr. Stebbins there sent me up here to Dr. Camerata.
And you were life-flighted.
I was life-flighted here at the age of 22.
10 years ago. So
10 years ago.
Started with a stroke. Dr. Chang, every surgery, as we know, comes with a risk. But how does that happen? A tonsillectomy, then leading to a stroke. Is this common?
No, not common.
Good. Well, glad to hear that.
Yes, but she ended up having this venous sinus thrombosis, which is a clot in one of her major draining channels that drains her brain. So that leads to venous congestion and can lead to what's called a venous stroke. So definitely not common, but as Alicia mentioned, she had other factors, risk factors there. But primarily after the tonsillectomy, she was dehydrated. She also had a clotting factor, and she had also stenosis on the sinus on the other side. So it was like all of these things, like a perfect storm, led to that.
That's what I was going to say, the perfect storm.
Yes.
So let's go back to 2015. And let's share this brain scan from when she was here back then. What are we looking at? This was an MRA. So what's an MRA? And
MRA is, well, it's actually an MRV. So an MRV is using MRI imaging to look at the venous channels in someone's brain. And if you look at where the red circle is, she's missing the transverse sinus on the patient on her right side. So on the left side, like to the left of the red circle, you can see the patent sinus on the left side. On the right side, there's kind of a blank missing area, and that's where the clot was.
So this was back in 2015. After you recover, you start noticing these episodes. In hindsight, we of course know they were seizures at the time, but can you describe what they felt like back then?
So back then, I would get really nauseated. I'd kind of get tunnel vision a little bit, but then really, I would get this flushed feeling. I would get really thirsty, and a lot of times I couldn't verbalize it always, but I would reach for water. I usually had a water nearby, or I would tell my husband, because we met shortly after I had this, I'd say, I'm really thirsty, or I'm not feeling well, and he'd grab me a bottle of water, and I would come out of it usually drinking water.
So how long would these last?
A few seconds to a minute or so.
And how often were they lasting?
I'm not sure, because we had no idea what it was, so we weren't tracking them, but after we learned, after Dr. Ulloa, diagnosed me eventually, we started tracking, and the week I had surgery, I had 9 seizures.
Let's go back, though, before you came to Dr. Ujoa, because you were seeing your local doctor back then. What were the doctors telling you? Because this is the part of the story I find very interesting.
Right. I was being told it sounds like you're having a panic attack, you have anxiety, it's understandable that you have anxiety, you have all these other conditions, so here's Xanax and good luck.
All right, Dr. Ujoa, what do you make of that? Let's bring you in. Being, would that, an anxiety attack, is that something that you would, something that could be misdiagnosed as that?
All the time. Yes, I mean, when a person is experiencing seizures, it is odd symptoms that sometimes can be caused by other things. Anxiety can be a part of it. And essentially, because panic attacks are so common, it is just kind of a common misinterpretation that a physician might say, well, these are probably panic attacks or anxiety.
Could they have been so subtle? Is that maybe why they were coming off as being...
Well, I mean, I think I wouldn't describe them as subtle, because to me those are the symptoms that often happen with seizures. But many people, when they think of what a seizure is, it's you collapse, you stiffen, you shake, you foam at the mouth, you know, the obvious seizure, which is what you had the very first time.
Yes.
But these symptoms, if you really listen and get a good history of what the person is experiencing, and from both the individual and someone that has seen it, you can most of the time really come up with the correct diagnosis.
So does this mean that people are having seizures and don't even realize that they're having a seizure?
Some people, yes, that can happen. And some patients don't even experience any symptoms. It's just someone that's with them that says, hey, you were staring off and not responding for 20 seconds. You know, you were kind of out of it. So even there are individuals that don't even experience the sensations. They just have kind of a gap in time.
You were going undiagnosed for about 7 years. Is that what I understand?
Yes.
And your husband, what was he saying during these times?
During those times, I had them the entire time. We knew each other, so I told him, oh, this just happens. It's anxiety. It'll go away. And usually it would be a few, a minute at most, and it was fine.
And you just got used to them coming and going.
Yep.
During this time, you welcome a baby boy.
Uh-huh.
How are you juggling day-to-day life, a new child, and these, what you were thinking were panic and anxiety attacks?
Right. So I was about 4 months postpartum when I had my grand mal seizure that actually ultimately led to my diagnosis, and it was really hard after I couldn't drive. But before that, I had no idea what was happening, so I was just going on with life as normal and continuing to see doctors for my thyroid cancer and all my other, and Dr. Abraham for my stenting and things like that. But until I was postpartum, and I think it potentially was like the change in hormones brought on the grand mal seizure that caused me to wreck my car.
Yeah, let's get to 2022, because you were managing, so to speak, undiagnosed. You have this grand mal seizure while you were driving. Explain what you remember about that moment.
So I remember I was sitting at the stoplight to turn to pick up my son from daycare. I was a few blocks from daycare, and I got really thirsty. I grabbed my water. I started to drive off, and after the light turned green, and I don't remember anything after that, but a bystander in a different car saw me seizing. They watched me stop and then roll into a pole. I was completely fine. My car was a little damaged, but that was okay. And they called EMS, which luckily was about a block down the road. And when they got there, I was still having a seizure.
So Dr. Ujoa, you come back into her life again. This is the second time that you meet her. When did you realize that this was the same stroke patient that you had seen 7 years ago?
Yes, so that's right, because when she had the stroke and had the seizure, I saw her probably a couple months afterwards with the question of, does she need to still be on seizure medication? We did testing, that was normal. She had been at least 6 months, if not longer, since the time she had the big seizure. So we said, okay, chances are with you that it won't happen again, taper you off of medication. but with the but of, if you start experiencing any odd symptoms, please call me back. I was not upset at her that she didn't call me back, but yeah, 7 years later, I meet her back, and I was able to, I did recognize it right away that it was her, and essentially she was having these seizures and only came to medical attention because she had another big one.
So those odd symptoms would have been those symptoms that she was having
Correct.
over those 7 years, where
Correct.
she was thirsty and having those little moments, and she just kind of brushed off thinking that it was anxiety and panic attacks. So finally, we get to a diagnosis.
Yeah.
What was the official diagnosis?
Temporal lobe epilepsy. So her seizures, the way she described them, sounded very much like temporal lobe seizures. We knew that she'd had some abnormality of her right temporal lobe, from the stroke. At that point, you were only on one medication, so we tried a second one, but ultimately she was still experiencing seizures. And so at that point is when we said, okay, you have drug-resistant epilepsy, and let's explore the surgical options.
So when you finally know what it is, what did you think?
I was so scared. I didn't know what to do because I had a young son. He was 4 months old at the time. And, well, actually, more like 6 or 8 months by the time I got to see Dr. Ujoa. But I didn't know what to do because I was told, you need surgery. And I was like, well, what else can we do? And so actually, at the advice of another doctor, I went up to Mayo Clinic, and they said, I didn't have a great time there. They treated me like a number, not like a person like Dr. Ujoa does. And so on the way home from Mayo Clinic, a few days earlier than we had planned, I called Dr. Ujoa's office and I said, let's get this going.
So what tests or tools did you use, Dr. Ujoa, to confirm this diagnosis?
The video EEG monitoring. So basically, we wanted to record the seizures to confirm that, my diagnosis was correct, that they were right temporal seizures. And then the MRI is a big part of it. So there was scarring in a region of the temporal lobe that was causing the seizures.
Okay, so you brought a scan, and it's not obvious that anything is wrong, but what are we noticing here in this photo?
So basically, the red arrow is pointing to the hippocampus on the right temporal lobe, and it's just not as normal as the other side. Is kind of flatter, it's smaller, kind of shrunken, and so that's something we call mesial temporal sclerosis, and that is a very common cause of temporal lobe epilepsy.
You said you were scared about this surgery.
Yes.
Was there any relief just knowing that you now know what all this was over these last 7 years?
There was definitely relief knowing and having a diagnosis and having an end goal, I guess. But it was definitely scary because with every surgery there's a risk. As we know, I had a stroke after a tonsillectomy. But Dr. Chang and Dr. Ujoa both did a very good job of reassuring me, making me understand the risks were minimal as far as mortality and all of that.
Sure.
So it was very scary, but we got all our affairs in order for my husband to take care of our son in the worst case scenario, and it worked out.
Dr. Chang, walk us through the procedure and what it actually involves.
Okay, so Alicia had what's called an anterior temporal lobectomy. So in that surgery, we make an incision over the skin, and then we create a window in the bone so that we are able to access and look at the brain. And then we remove the anterior portion of her temporal lobe in here. And then we use a microscope to reach down and remove the hippocampus, which was the abnormal area that Dr. Ujoa pointed out on the MRI, and to remove the amygdala, because those are the deeper portions of the temporal lobe that are causing the seizures.
Dr. Ujoa, she mentioned a second opinion. How important are second opinions when it comes to this type of surgery?
I mean, I'll say this. My primary goal is that the person is confident and comfortable going into whatever treatment they're going to go into. If, whether it's me or any other doctor that a person sees, if you don't feel like you're ready, that that there's just still some lingering aspects, and I would say absolutely get a second, a third, a fourth opinion. People should not be scared of that. your doctor should never be upset about that, because you're the important person, and so I think it is important, and if it comes with peace of mind, then it's worthwhile.
And when you hear that brain surgery is on the table, that's a
It's a reason to go get a second opinion.
Absolutely, absolutely.
Yeah.
And brain surgery went well for you.
It went really well, yes.
You shared some photos of your surgery scar. Thank you for being willing to share this with you. It
but
healed.
Dr. Chang did the best job because my hair is parted on the left, as you can see, and it just fell really nicely over that. If I didn't have it pulled back, you couldn't even tell that I had surgery.
You're all smiles on surgery day. So tell us a little bit about the
And that was when my
experience.
first stitch came out. I don't know if you saw that picture of me with my little finger up, but yeah.
I love that. So tell us a little bit of just about a surgery. I mean, not very many people can say and share their brain surgery experience with people. What was recovery like? Tell us.
I've had a few surgeries over my lifetime. So it was typical of normal surgery, pain and all of that, but the hardest part for me was going 4 weeks without really holding or cuddling my son. So it was, it was a month before he sat on my lap and I got to hold him and hug him. So that was the hardest part of it, but really the recovery from the surgery wasn't that bad. I mean, it was painful, of course, but hair's still growing back. It's pretty long now. You can't see it at this point, but I have always had, since I had a radial neck dissection in 2016, and so since then I've had neuralgia on the right side of my head, and so the pain post-surgery was about the same as what I've had, so I just went back on medication for the nerve pain.
Well, we have a scan of your brain after surgery. And in the bottom left of the picture, there's a white space where you used to have some brain tissue. Dr. Chang, how is it possible that someone can lose a pretty sizable chunk of their brain and still be okay?
Because there is redundancy in the brain, we know just from a lot of other things, like things that people may have, traumas, tumors, that we can remove parts of the brain and people can do well. The temporal lobe surgery that Alicia had was the most common form of surgery that we do to treat epilepsy, because temporal lobe epilepsy is the most common form of epilepsy that we treat surgically.
The brain's pretty magical, huh?
Yeah.
Yeah. Alicia, since that surgery, how have you been? Seizure free?
Seizure free, yes. And I, during that time, after, it's been almost a year and a half now, and I got promoted at my prior job, and I'm now at a new job as the financial controller for Crawford County Mental Health. I got recruited by a former coworker who saw me through the surgery. Actually, he's the guy who was texting my husband the day of to make sure he was okay. Fantastic. And that I was okay.
Well, so congratulations.
Yeah, very cool. And so I've been there for almost 2 months now, and things are going great. Life's going really well. We have an exchange student from the Czech Republic, and she's been with us since September. She'll be with us till June, and my son turns 3 in June. So it's just been a year and a half of opportunities that I really didn't think I was going to get.
You brought a picture because it's prom season. You have a picture of your exchange student and your son. And we want to show this because, again, you have an exchange student living with you. That's probably not something that you would have been able to do during that past 7 years and with everything you had going on. So, again, just another big event.
Yeah.
Tell us a little bit about this.
So about Adela, well, she's from the Czech Republic. She's a sweetheart, but I saw a post on Facebook that was like, hey, we're trying to get this girl placed, and we have until the end of the weekend. And it was Thursday. So I told my husband, I was like, hey, let's just do this. Let's do a temporary home for her. And then it turned into the whole year. But it's been a lot of fun. And we talked about it just the other day. I was like, the reason I did this and wanted to do it is it's not something I ever thought I would be able to do. And he told me I'm just addicted to stress.
No, I think you're just checking a lot of good boxes.
Yeah.
I think that's great.
Yeah.
Dr. Joa, is it an appropriate term to use the word cure? Is her epilepsy cured, or is it still there?
So epilepsy is a tricky disease, and I've been doing this now for 15 years, so I probably use that word less than when I started, but absolutely. Patients can be cured from their epilepsy. And I think the key is the longer you go without a seizure, the more confident we feel that you have been cured. So.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is right there on your screen. So, Alicia, looking back, is there anything you wish you would have known back then? Anything you would have done differently?
So, something I wish I had known and that I wanted to share with everybody is something that Dr. Ujo had said to me during one of our visits. Had I known and had my family known that seizures are usually a few seconds to a couple minutes, whereas anxiety or panic attacks usually last longer, like 30 minutes or so. Had we known that 7 years ago, or almost a decade ago now, actually, we would have had a diagnosis a lot sooner.
Dr. Ujo, what advice would you give to someone who suspects that they're having seizures, maybe doesn't know, hasn't gotten the right answers yet? What do they do?
Don't give up. Keep seeking answers. Start with your primary care doctor. They may refer you, to a neurologist. But ultimately, just keep seeking answers. I want people to understand that all neurologists can treat epilepsy and seizures and diagnose it because it is such a common neurologic disease. But when it becomes harder to diagnose, harder to treat, that's when you want to see a specialist like myself, which is someone who's a neurologist but did subsequent training just on EEG and epilepsy. And then that's a physician that then would really be able to handle what might be a harder diagnosis or harder treatment and surgical options and things like that.
So what does it mean to be a comprehensive epilepsy center like we are here at the health system? What does that mean for a patient?
So practically speaking, it means that we have a group of doctors of different specialties, like Dr. Cheng in neurosurgery, myself in neurology, neuroradiology, a whole team that is focused just on the care of people with epilepsy. And so it just means we're very highly specialized. It also means that we meet all of the requirements of the National Association of Epilepsy Centers.
Dr. Cheng, how has technology improved epilepsy surgeries through the years?
A lot of different ways. We have a lot of new tools and innovations, such as our robots, which help us to do precise implantations. So sometimes people need to have intracranial EEG, where we have electrodes or thin wires that go into the brain tissue to help us fully determine where the seizures come from and how to treat them. And so we can use our robotic technologies for that. There's also been new devices that are being used that can treat epilepsy by stimulating the brain rather than a removal of brain tissue. So that has been something that has grown a lot in the past 10 years.
So other surgical options?
Right, other surgical options.
Let's get to some questions from our viewers this morning. And Stuart has one. What do doctors tell patients who are understandably nervous about brain surgery for epilepsy? How do you have that conversation?
Well, we try to openly present, everything. These are the benefits. If you have drug-resistant epilepsy, we don't think it's likely that your epilepsy will be adequately treated with medications, no matter what combination of medications we try. Surgeries do have risks, so we try to tell the patients what those risks are and what are the incidents, and generally they are low risk. And so basically we have to inform the patient fully and let them make that decision to go forward.
Amy has a question, and you mentioned it earlier in the program, but explain it for people who may really need to know. But how frequently did you have seizures, and did you notice any changes in frequency or intensity back then?
So prior to having the grand mal seizure in 2022, I wasn't sure. I'm not sure how often. I know at least once a week probably, but after having my son, my husband said, oh, they got worse, probably hormone changes. But the week of my surgery, again, I had 9 seizures. So even with medication, we were treating it with medication. And I had a reaction to one of the medications that was working pretty well, but had to immediately stop it and go on something else. So I'm still on that same medication, but without seizures.
Okay, we have a very important comment from a very important viewer this morning. Tommy, I don't know if you know who Tommy is.
Yes.
Tommy says, hi, Mommy.
Tommy is my son.
Tommy's watching on YouTube this morning, so.
I think his dad's watching, but
yes, Tanner, that must be your husband.
Yeah.
Okay, so Tommy, we're so glad you're watching this morning. Ruth Ellen has a comment. So happy for this young lady, her family, and taking on an exchange student is priceless. So thank you for doing that. Jeremy has a question. What it is about scar tissue on the brain that can trigger seizures? And does having scar tissue almost guarantee you'll have seizures, or just make it more likely that you'll have seizures?
Well, the second question is easier. Yes, it makes it more likely. It doesn't guarantee that you'll have them, but it does make it more likely. The first question is pretty complex. The way I kind of describe it simply, just in a conversation with patients, is there's just irritability of that part of the brain because it's not completely normal. But really, it's much more complicated than that when we talk about different, the brain cells themselves and the electrical currents that go through channels within the brain cells, the molecular mechanisms. So I'll get you a textbook that talks a lot about it.
Jeremy always has very, very good, intense questions. He's always listening very well. Dr. Joe, what's the big takeaway today for folks listening?
I probably say the same thing every time you invite me, but it's because it's really important. People need to advocate for themselves. If you feel you're not getting answers that make you feel confident that you have the correct diagnosis, continue that search. It's just, you have to feel comfortable with your doctor. You have to feel comfortable and confident. And if that's not the case, find a different doctor.
Dr. Chang, what's the big takeaway today?
I think I have similar comments to what Dr. Joe has said, but mainly about what is drug-resistant epilepsy. So, like Alicia, 7 years of being misdiagnosed and then finally getting treatment. We commonly take care of patients who've been treated with medications for 20 years, 30 years, and then they were never told that surgery could be an option that could be more effective to treat their epilepsy. And so I feel like I'm echoing Dr. Joa's comments that, if you have epilepsy and then you're just on these medications and they're not working, then perhaps seeking a comprehensive epilepsy center to get an expert opinion would be a good idea.
Alicia, thank you so much for being here and sharing your story with us. We're so glad you're doing well. What's the big takeaway from your story?
For me, I would say the same thing. I mean, continue seeking treatment. Make sure you're comfortable with your doctors. I've been very, very fortunate. Even though I've gone through a lot, I've been really fortunate to be connected to so many great doctors. Dr. Ujoa, Dr. Chang, my doctor back at home, Dr. Galt, and I actually also had cancer prior to and after having my stroke. And Dr. Menon, also a KU med doctor now, has done a really good job treating me for that. And he actually has gotten me some of my connections with great doctors up here. So.
Well, you have an incredible story.
Yes.
So be well. Thank you so much.
Thank you.
And thank you to all of our viewers for being here with us today. We'll see you back here tomorrow. For many amputees, losing the limb is only part of the challenge. Phantom limb pain can be an excruciating distraction from daily life. I'm Jessica Lovell on the next Open Mics with Dr. Stites, the surgical advancements that rearrange the nerves, offering new hope for pain relief. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.